Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Management of polycystic kidney disease. So polycystic kidney disease is mainly treatment of this polycystic kidney disease is the main aim is to control the urinary tract infection. We should control the hypertension of the patients. We should make sure the caliculi will not form, and we should also take general measures like uremia are also taken. Then, pain relief can be done by percutaneous instillation of sclerosing agent or by Rosing's operation. In Rosing's operation, actually, there is one cyst is present in the kidney, so this cyst can be de-roofed and the whole secretions can be removed. So Rosing's operation can be done, and one more way is percutaneously. You can do aspiration from the cyst and you can instill the sclerosing agent. This is mainly done to relieve the pain of the patient. Treat if there are any infections, you can treat it with ciprofloxacin or any antibiotics. And renal transplantation and dialysis are the only definitive treatment for renal failure. For renal failure, dialysis and renal transplantation is the only definitive treatment.
thank you and thank you for watching.